Really, there's no reason you can't be healthy with all this stuff we're going to talk about today. We're going to educate you on how to eat, what to eat, and regenerative care on stem cells. Functional medicine is health orientated, so they try to keep you healthy or make you healthy. So patients, and they do that, it's patient-centered, so we spend a lot more time. So MDs, they're on a schedule of 5 minutes, right? So they're not spending time with you, so that's where the problem is. So we in functional medicine do spend time with you. We sit with you for many, many hours basically and get to know your health and start different protocols all the way to get rid of certain things. And it is complicated, so we start all these protocols, and then it gets simpler, simpler, and simpler, and then very few things show up, and then it gets really simple. So this is the kind of stuff that we've done in the past and currently do medical services, which is stem cells, exosomes with our nurse practitioners, some weight loss, functional medicine, chiropractic, physical therapy. We have a team for biogenetics that comes in, so when a patient signs up for functional medicine with us for a year, we fix them up, and then we blood test them, and we figured out what else is not in the green zone of lab tests, and they come in with their think tank, a bunch of PhDs, some MDs, chiropractors, nutritional NDs kind of thing, and they have a whole team. They do circles around me with biochemistry, even though I know biochemistry. I'm blown away what they know, and they don't see patients. All they do is they monitor our patients, and they just tell us what to do. So now we're going to learn about regenerative care, stem cells. So if you can't exercise because your joints are arthritic, they kind of boost you, and they give you a head start. So we put stem cells in here, and they hunt down the inflammation, because when you have arthritis, you have inflammation. They hunt it down, they reproduce into millions and millions and millions of stem cells, and those things end up becoming whatever you want them to be. So in here, it would search out and say, I want to be cartilage, so they become cartilage. So they replicate so we put a few million into a knee joint, they replicate into millions and millions, and after they replicate, they become whatever you want them to be. So you have to imagine what it's going to be like. So the first step is to get rid of your pain so you can exercise, and it gives you motivation to eat right, and it just goes on and on from there. The stem cells are the ones you want to do first, and exosomes, to get your health right so that you can function, so you're not getting out of bed going, oh, my achy joints, and not being able to do anything. You got one life, and this is it.